All right. I know we've done this before, but still, like Marco, can you introduce yourself?
Yeah, happy to introduce myself. My name is Dr. Marco Nunez. I have a doctorate in athletic training. By nature, I am an athletic trainer, or what I refer to myself as a performance athletic trainer. I've been working in this field for about 25 years. The first 22, 23 years, I actually was working in professional settings. I spent the last 12 years as one of the directors of sports medicine for the LA Lakers. Prior to that, I was with the South Bay Lakers, the LA Sparks, and also kind of arena football. Now I kind of do independent contracting. I work with private clients, both in the NFL, high school, collegiate, and also have the opportunity to work with just general private clients. And also, like I mentioned, because I live in LA, Hollywood is kind of in my backyard. I also have the opportunity to work with several celebrities, both just to get them in shape, rehab them in a sense, or if they're getting ready for a movie role. My job is to kind of get them in there and get them ready to be able to perform.
Cool, cool. So, um, can you talk a little bit about your journey at LA Lakers? I know I like we talked about this before, but I just enjoy that. Sorry.
Like, wait, what? Ask it again.
So, can you like talk a little bit about your journey about when
With the
you were
Lakers.
at LA Lakers?
Yeah, I mean, I'm happy to do so. It's the one thing, I always get asked from younger athletic trainers, strength coaches, and physical therapists, how can I get in there? How can I work in the professional setting type of thing? Everybody wants to kind of work in that setting because that's kind of considered the gold standard or the top level of working in whether you're a strength coach, athletic trainer, physical therapist, a dietitian, or anything of that sort. Um, Unfortunately, if you sit down and speak to every athletic trainer, every physical therapist in the NFL, NBA, NHL, anything of that sort, they will all tell you that they took a different path. Unfortunately, there's no one way. Like if you're trying to be a strength coach, you get your certification, you go to school, get your degree, get a graduate program, and then boom, kind of the same thing with physical therapists. There's no way, there's this thing and I'll be honest, luck has to do a huge part of it, right? But if you look into luck, there's a definition of what luck is. When you get lucky, lucky is the definition is when opportunity meets preparedness, right? So you have to be prepared for when that opportunity shows up, okay? Because if you're not prepared and that opportunity shows up, you're not going to get there, or vice versa, right? You can be prepared all you want, and if that opportunity doesn't arise, then once they kind of meet, and I think that was kind of like the opportunity that I had, or the luck that I had, is that the opportunity showed up, was presented to me, and I was prepared for it, and so I was able to kind of go work with the Lakers. But the way it kind of evolved, and for me working with the Lakers, is actually it started with the LA Sparks. Um, I got hired with LA Sparks as their head athletic trainer. At the time, the LA Sparks were owned by the Lakers. Dr. Buss owned the Sparks. So our locker room, our training was literally right across the hallway from the Lakers. So I got an opportunity to meet Gary Vitti, Chip Schaefer, Alex McKegney, Marco Udovodi, all the staff on there. And slowly by slowly, they kind of brought me on board. I kind of helped them out. I interned with them. I went to summer league with them. I went with training camp with them, type of thing. And then the Sparks bought their D League team, their development team, which is now known as South Bay Lakers. I was hired on to become the head athletic trainer there, and then finally, when there was an opening for an assistant athletic trainer with the Lakers, that's when I came on board. But I think that the difference for myself is that when the Lakers were looking for an assistant, so to speak, they weren't looking just for an assistant athletic trainer. They were looking for an assistant strength coach. They were looking for assistant rehab therapist. They were looking for assistant massage therapist. So instead of hiring four people to do the different jobs, I had the skills. I was a certified strength and conditioning. I'm an athletic trainer, massage therapist, rehab therapist. So they decided to hire me on board to be able to fill all those gaps. So I was kind of like everybody's assistant. I was going here, there, type of thing. Wherever I was needed, I would kind of fill in type of thing. And I think that's one of the things that nowadays people are slowly starting to realize, that you can't just pigeonhole yourself to one position. Meaning, if you're a strength coaches now understand mobility. It's not just, hey, we're going to do power cleans, we're just going to do this. They understand mobility, they understand stability. Same thing with physical therapists. Physical therapists nowadays is kind of funny though, because I've noticed physical therapists are now calling themselves performance therapists or sports physical therapists, because they understand that they can't just stay in the clinic and work with people that get injured. They want to work with athletes, and working with athletes is a little bit different than working with the general population type of thing. Um, so, and athletic trainers are starting to kind of evolve. So, understanding the concept of performance in general is going to help you as an individual.
Nice, nice. So, um, I want to like talk a little bit like deeper about this. I know we kind of like discussed about this before. It's like nowadays there's like more and more sport tech like force play, velocity-based training. I feel like coaches are more biased into looking at numbers right now. They don't appreciate the movement. But
Yep.
what happened was like it's just like 10 minutes ago. What happened was like I was trying to explain the force velocity curve and
Yep.
force displacement curve for from one of our athletes to the coaches. And he asked me to explain why is that, why is what. So I explained like what exactly is force displacements curve and force at zero velocity. And I said at the end, I said, look at how they move. Do you think there's
Yep.
those match together? Yeah, it match together. So if we don't have the tool to look at it, or if we don't have Hawking dynamic to look at it, see, I can easily know it by from looking at how athlete move.
Yeah.
Yeah.
You're absolutely right. Here's the thing about technology and sports science nowadays. Okay, I think you're right. I think a lot of people are so like, we got to use sports science, we got to use technology, we got to do this type of thing. At the end of the day, okay, sports science, measurements, technology, all it does is trying to help you understand. Either is trying to either validate that what you're doing is working, or trying to teach you, hey, the program that you've implemented, whether it's rehab or strength and conditioning, it's not quite working for this athlete. So either are they progressing or are they regressing? That's pretty much it. Also, when it comes to return to play, it's just a tool to allow you to determine whether this athlete is. I wouldn't even say if they're ready to return to play. It's basically utilized to determine their percentage of the risk of re-injury or injury. That's it. Does it mean that they're not going to get injured? No. Does it mean that they're going to get injured? No. Okay, that's all it is. But you're right. And here's the other thing about it is that when I talk about ACL recovery or ACL or return to play in general, okay, there is like two. Well, there's more than two elements, but the two key elements is when you do an assessment in a controlled environment where the athlete, with most of these, are most of these assessment force play testing, um, what's it called, the force plate. You have the force plate testing. You have these camera system movements. You have what's it, the God, I can't think of it. Not the other one. Even if you use like FMS, you use something like FMS, anything of that sort. All of this is in a controlled environment. But athletes don't play in a controlled environment. They play in an uncontrolled environment, right? And that is kind of where you want to see those movements. So when you're talking about when you're watching the athlete move, you can see more while they're moving versus while they're in a controlled environment. But the example that I gave everybody, right? Okay, and I don't know if I told you this already, and I think we might have talked. Okay, here in the States, when you get your license, right? When you have to drive a car, what's the first thing you need to do? The first thing you need to do is you need to get your permit, right? And your permit is you go take the test, a written test. And what do? You get to study for it. They give you time to study, right? Then you go and sit down in a room, nice, quiet room. It's all controlled. You take the test, you pass it. Okay. Then once you get that, then what's the next part? You need to get out there and show that you're able to drive around with traffic, with trucks, with rain, with weather, stuff like that. And that's how you determine. And I think we often forget that portion of the return to play. We're so ingrained that, hey, they got to do well in this controlled environment test, but we forget that other portion. That other portion is where you're going to get in an accident. That other portion is where the injuries occur. Not, I mean, while you're sitting down taking the written test, the odds of you crashing a car are zero. All right. But I understand if you can't pass that written test or you cannot pass a controlled test for return to play, odds are you're not going to go out there, right? So I get it. There's a one part and then the other part type of thing. But yeah, I think sports science is good. You want to use it, okay? It's just a tool, just like dry needling, just like Graston, just like everything else as a rehab therapist. They're just tools to help you as an individual, strength coach, therapist, athletic trainer, to make better decisions for your athletes. Bottom line. Okay.
Yeah, and like what like this is interesting because what actually happened, I can't say the name, but one of my friend, he's a really
Uh-huh.
good friend of mine. We
Uh-huh.
discussed about like return to play from ACL and overall like controlling stiffness, controlling injury, manage injury during the season. Usually what we want for like increasing performance
Uh-huh.
is uh we want athletes to become stiffer. We want them to become stronger
Mm.
so they can decelerate faster, they can jump faster, they can
Yep.
like so we look at the eccentric brake velocity,
Yep.
the eccentric braking force. But but what I found and what I talk with my friend is when those numbers go up, the performance go up in a certain amount of time. But if you look at the long term, low back pain, adductor issue, groin pain. So I want to like talk about this is like how important is like looking at like pure athlete, how they move. It is just so important to look how athlete move. Healthy is the most important thing, right?
Correct. Yeah. So you always want to analyze their movements, right? And of course that's why I think they had created was it Gray Cook created the FMS screening, which is functional moving screening that you're looking at them how they move, um, and you want to probably start there. The FMS is a movement is a screening that looks at movement, like you said. Yes, it's in a controlled environment, but if they fail that controlled environment, you know that when they get on the court or they get on the field, they're going to be kind of all over the place. Then you also want to analyze more of a dynamic movement when they're moving around. And then you want to analyze hopefully a movement where they're, like I said, in an uncontrolled environment when they're reacting to something of the sort. I'll give you a prime example. When I'm testing somebody for return to play in ACL, right? They always have like these force plates, and there's one test where they have the athlete sprint, and then when they get to the force plates, they're supposed to put their foot there and then change direction, right? And you're trying to test how much other force is being applied from the right leg and the left leg. But I'm not a big fan of that because at the end of the day, the players is accelerating or I'm sorry, decelerating to try to make sure they hit the force plate. So what I do instead is I do two cones, like about 10, 15 yards, and I tell the athlete, run as fast as you can. Once you get anywhere in that cone, when you feel ready, you plant and change direction. So now I'm trying to get true movement on that part. Or the other one I do is that you want to sprint as fast as you can. Whenever you see my hand come up, then that's when you want to react. You're reacting to me, so you're reacting to the opponent. Then I want you to change. And it's funny that if you do that, if you do the force play, you do it when they self do their movement or they do the reaction. The force being played on the knee, where their valves or anything sort, is going to be completely different in all those three elements, which is interesting.
That is so true, man. That is so true.
Yeah.
So I want to talk about like I know this depends, this is a big topic, but I want to talk about uh do you have a like a systematic movement assessment that you built or it depends on the situation?
You know what? I'm not a fan of a cookie cutter program. I've never been a fan of on that part. Um, Unfortunately, I don't have, and I think this is where everybody's still trying to kind of figure out that final portion of the return to play. Okay, everybody has like the front part, the FMS. Everybody has the movement screening. Everybody has the force plate. Everybody has the camera assisted motion testing, stuff like that. But I don't think anybody has quite figured out the final portion. I like it more on individuality. Two, I like it more on being sports specific, but not only being sports specific, but being position specific. Okay, it's funny that you bring that up because I'm actually going to start consulting with a company called Strive, where they wear it's wearable technology. They have EMG sensors that test your quads, your glutes, your hamstring output, and muscular output, and they want me to kind of help them create a return to play program, but more on the field. And what I like about this is that they're shorts, they're tights that you put on, and you can go and run and do whatever you want. You can do the hops, you can do everything out on the field, and then you can test them and see how they're doing on that part. And I kind of like that because you're out in the open, you're on the field. There's no restrictions where like when you're in a clinic environment, you have a little restriction, but there's nothing wrong with that. It's just part of the process type of thing.
Nice, nice, nice. So, enough for the assessment, enough for the sport text and movement
Yeah.
stuff. I want to ask like specifically about like scoliosis and pelvic obliquity.
Yep.
So, I know talked to this before, but like, uh, does like these two always like come together, and how would you fix it, or how would you assess it first and then fix it?
Yeah. So here's the thing about it is that whenever I work with anybody, okay, the first thing I do before we start a movement, I'll get them on the table and just assess the hip balance, so to speak. Okay. And what I tell everybody is think of the pelvis, because you use the pelvis kind of, anterior, posterior, and lateral, medial. But the pelvis is pretty much like a teeter totter. It rotates in all directions, right? It's not just anterior, posterior. It's not lateral, medial. It rotates in all directions. Um, so I'll get them on the table and first assess them, see if there's any hip imbalance. Okay. And hip equity is pretty much hip imbalance. And then try to identify what's causing that. Is it muscular weakness in one area, oftentimes, or is it muscular tightness in one area type of thing? Scoliosis, because it's already curved, it's going to create a little bit of an imbalance. I remember we had an athlete with the Lakers that had scoliosis, so we had to constantly reassess him every single day, even at halftime when he would come back at halftime. Hey, let's get on the table to see if you're still imbalanced and kind of make a little correction. And oftentimes you either find either like a hip hike where one leg it's not a leg length discrepancy, it's just a little tightness kind of shift, or you see where the ASIS joint is tilted a little more forward or backwards or anything of that sort. Okay, and then once you do that, through assessments is identifying, well, is it muscular tightness? Is it TFL tight? Is the adductors tight? Is it the hip flexors, iliopsoas that are tight that's creating that motion, or is it that the hamstring's so weak that it's not allowing that pullback on that part? So I always kind of do the assessment and kind of look at the part, and it becomes a little tough on that part to try to kind of be able to identify it. And you have, as a practitioner, strength coach, physical therapist, our job is to try to kind of identify it and then correct it. And like I said, either it can be either through soft tissue mobilization or it can be through strengthening on that part. Like for example, anterior pelvic tilt. What is it causing? Is it the iliopsoas that's tight that's pushing it forward, or is it the hamstrings? Or it could be both. It could be a combination of both. And then that's where you have to focus on creating elasticity, flexibility in the front, but creating that strength to kind of keep that balance back.
So, uh, do you use like manual like therapy, or like try to maybe some correction to like help them but back to
Yeah.
the
So
right position?
Yeah, so one of the most common things I tend to use, and it's very commonly used. One, of course, is do manual therapy, right? Meaning I get in there, do myofascial release, do muscular release, do pelvic joint mobilization, also with the belt, and kind of move that around and kind of open that up. Okay, once I can kind of get that, and then the other one also is trying to identify which is tight, which is loose, and you do kind of you probably done it with the bands of the ankles, and one's coming forward, one's coming back, while they're trying to create that pelvic tilt or the neutral pelvic motion to try to kind of sustain it. So it's a matter of trying to identify, is it more the hamstrings that you kind of, is it the right hamstring, the left hamstring, or is it the hip flexor that's kind of either maybe the hip flexor the weak when people are kind of more back type of thing. So it's just trying to identify which one's tight or which one's weak, and then addressing those issues.
If we don't like, what happens if we just try to like correct their uh um bone, like I don't know the right, but the structure, we just correct the structure without like try to releasing the tightness and try to activate the correct muscle? What happens?
Well, outside, if you're just trying to kind of correct the bone with correcting the discrepancies, they're just going to be compensating while they're moving, and they're just going to keep experiencing discomfort somewhere. Okay, the question is where. I'll give you a prime example. Okay, I'm working with a basketball player. He's Chinese. He kind of flew in because he had ACL surgery about 10 months ago, and he's still having some pain, kind of like in the patella tendon. So when I assessed him, and he has a terrible squat motion, and the pain is coming. He's having pain in the knee. Well, he has poor ankle dorsiflexion on the left side, and he has poor hip mobility on the left side. Without even touching his knee, doing anything to his knee, we got more range of motion on the left side. We got more hip mobility on that side, and the pain had already kind of decreased, type of thing. So you have to kind of address these issues versus I can either just start treating the knee type of thing. But the whole thing issue that he was having, he was compensating because of the discrepancy issues.
Nice, nice, nice. Since you brought up like ACL, ACL is a topic that I'm really interested right now.
Yep.
So, like, can you kind of like explain it to us, like what exactly is causing the ACL injury, or like the biomechanic of like people getting torn their ACL?
Well, see, if you look at, I think majority of the ACL injuries, and this is funny because most ACL injuries, if you look at, are non-contact, especially the big ones. So the contact ones, you can get it someone, especially in football, they knocked the knee, they rotated, it got planted, it got locked in, boom. The non-contact ones are probably the ones that I don't want to say they could be prevented, but hopefully can be identified and addressed. Okay, and it's just that imbalance of that um, contraction between the quad and the hamstring that's so fast that it doesn't allow, as the tibia shifts forward, there's not enough strength to kind of sustain it and balance it and maintain it without it shifting too forward. And that's when you kind of pop the ACL. And oftentimes these injuries occur either they're non-contact issues, but it's more from either a deceleration or more of a reaction to an opponent or somebody else. That's why I say that when you train, you have to train in an unexpected or unpredicted environment.
Nice, nice. So, after ACL, I know you work with some NFL athletes, and like this year, there's like a lot of like Achilles
Mm-hmm.
tendon injury, Achilles tendon tear. So I want you to like touch on that. What are your thoughts on that?
Uh, it's kind of interesting though, because I think in the NFL right now, and this may change, there's a little bit of a push, or players are starting to complain. And I've seen this kind of posted on Instagram and Twitter about playing on turf. They've done there was a couple of studies that came out that playing on turf actually increased injuries to NFL players versus playing on natural grass type of thing. Um, yeah, there's been a few more ACL injuries, a few more Achilles tendon ruptures this year than the past. And the interesting part about this, I think I was reading an article that I think the World Cup is coming into town, right, into the U.S. And the interesting part about this is that the stadiums where they're going to be playing the World Cup, if there's currently turf, they're going to take out the turf and actually put grass while the World Cup is going on. So the question is, well, why don't you just keep the grass? Why, but when it comes to football, soccer, they want to play on grass because they understand it's probably a little bit less. So it's kind of interesting. So right now, the issue is the turf the one that's causing more injuries than the grass, at least in the NFL right now. So that's a little bit up to debate. So we'll see what happens with that.
So, do you think that is it really is it really the turf, the grass, or is it like maybe maybe athletes just didn't train during the off season, and when they come back to the training camp, the loading just spikes, or like is there like maybe they push too much, the ankle stiffness not enough, or maybe it's changed direction, or does like does is Achilles tendon more tend to be injured by acceleration, and the ACL is more tend to injure themselves by change of direction and deceleration?
Which what yes, so commonly that's kind of like what's been looked upon. Like you mentioned, ACLs are more often during the deceleration, change of direction type of thing. And then the Achilles tendon, what they've shown is more of the acceleration on that part, or that quick deceleration back to acceleration. Where on where the ACL is more that stop deceleration, that deceleration effect, and then trying to go back to that acceleration type of thing. And Achilles is kind of the opposite of that end. Can it be the fact of lack of training? I don't know because I don't know what like Aaron Rodgers. I don't know what he did during the offseason. All these athletes, J.K. Dobbins. I don't know what he did during ACL. Now the other question is, like for example, I know J.K. Dobbins tore his ACL what 2 years ago, 3 years ago. So the question is he is it possible that he may be prone? His rehab, his training, or anything of that sort. I don't know what the training was, so I can't really say, hey, I'm gonna blame it on the training. So it's tough to say that. Yeah. I don't want to throw anybody on the bus.
Yeah, I know, I understand that. Sorry. So,
No problem.
um, do you think we can any way we can like probably try to predict? I know this is a hard one. Try to predict it or try to like maybe try to look at how they move, maybe try to look at that number, whatever it is, should maybe prevent this.
So it it's impossible to predict injuries. Okay, that's the number one. You cannot have unless you give me a crystal ball and I can kind of predict. Can you identify the risk of injury? Yes, yes, you can. You can hopefully identify. But even then, here's the thing. Even then, if you have somebody that has, let's say, they have an 80% risk of injury, and then you have somebody that has 5% risk of injury, the person that has 80% of injury doesn't mean that they're going to get hurt. That's the fun thing. That's the messed up part of it. The person that has 5% risk of injury doesn't mean that they're not going to get hurt. Okay, there's a chance that that person that has 5% is going to get hurt. The person that has 80% is never going to get hurt, type of thing. So it's kind of tough because there's so many other variables, environmental variables, meaning the weather, the field, the opponent, who you're playing, the intensity that we cannot control or predict, and that's what kind of what makes it hard for to try to determine that last bit of portion of return to play. Say, hey, this player's ready to go. Hey, this player cannot play in rain because their risk of injury is higher. But how are we going to train them in rain unless we're going to put up showers, field stuff like that. So it's that last portion is kind of tough. All we can do as practitioners is determine the risk and make better decisions and say, hey, he or she's ready to go.
Yeah. This is like this conversation happened yesterday with our team physio. Shout out to Brett. He's a like really good physio. So what he
Uh-huh.
said is like oftentimes we think that maybe this A athlete is gonna get injured. He never get injured. And
Yeah,
often
exactly.
this B one, oh, he's good. His movement's good. The number is good, but he just get injured all the time. So like this drive all of us crazy.
Yeah, well, that's what I'm saying is that there's so many other variables that we cannot assess, right? Like I said, weather, we can't assess weather. We can't assess the field, the opponent, the opponent who they're playing against. If this player is good, are they going to double team this player? Are they going to triple team this player? So now you have three different opponents coming at this player. There's three different unpredictability movements, three different changes of directions type of thing. It's tough. I mean, that last bit of portion is tough to be able to predict because there's so many variables that we cannot control. And that's a tough part.
So go back to like what we kind of start is like this is so important to look at how athletes move as a at a chaotic situation. Like when they play the
Yes.
game, when they practice, instead of just moving it even like SFMA, even like all those camera systems, it's not enough. The most important thing is
No.
watch how they move at the game.
100%. The one thing I've always said, if like in basketball, right? If we can get the whole basketball court and it's a whole basketball court is a forced plate that we can see while they're moving during a game or during scrimmage, that would help us a little more because now we can actually see in live play. But they're not going to put a force play because the force play is too hard, and then you're going to start getting like Achilles tendonitis because there's not enough issues type of thing. But yes, that's why I kind of like the company Strive that has the shorts with the EMG sensors, so you can kind of get them out there. They're playing, they're moving type of thing. It's funny because those same shorts, I remember I was using them or I was testing them out about 4 years ago. I went to China to go consult for a team called the Macau Black Bears. And I had 5 pairs of shorts. I had like the top 5 players wear them. And this is exactly what you're talking about, right? And the point guard had the shorts. So I'm kind of monitoring their movements. And what I'm doing is I'm monitoring their leg discrepancy, right to left leg. How much is it increasing? Are they balanced? Granted, one's going to be more than the other. If they go to the right, that's more leg dominant. But as the player's playing, and this was during a preseason practice game, right? So he's playing, and all of a sudden I start seeing more like he's using his right leg more power, more the right, more the left. So I tell the coach, hey, during time, can you pull him out? Can I talk to him? So he pulls him out. So I asked him, hey, what's going on? Are you okay? He's like, no, my left groin is getting tight. So he started resorting to his right leg. So I take him out. I do an assessment. I release the hip, get more mobility in the area. He goes back in place, and he was able to finish the game with no issues. And I was able to monitor him while live movement. Now, was I able to prevent an injury? I don't know, but I was able to kind of hopefully identify, hey, something is going on. You're not going to have the answer, but at least it gives you an idea. Okay, something is wrong with this player while they're in live movement, and that's what the science told me, or at least the what I was monitoring. I took him out and kind of reassessed him, type of thing. And yes, I rather do more live movement, like you're talking about, than kind of more in the clinical. But yes, do we need to do the clinical part? Yes, that's part of the process, but that's not like the end part. The
Yeah,
motion, the movement out there during live event, that is should be the final part. That's the key part. I personally think that's the key part.
nice. All right. So last part of this podcast. I know
Yep.
we also talked about this before, and people are gonna hate me about asking this. So I'm a Kobe Bryant fan.
Uh-huh.
And now LeBron is in Lakers right now. How does this like is everybody kind of like does LeBron James uh like kind of like win over everybody now, or is it like it's still a Kobe Bryant city?
So in LA, it's still a Kobe Bryant city. It will always be a Kobe Bryant city. So I had the opportunity to work with Kobe, so I might be a little more biased type of thing. But I also had an opportunity to work a little bit with LeBron. What I tell everybody, and this is funny because this is what Kobe one time, and I think I kind of mentioned this to you, is, and the funny part about this, if you think about Kobe, right? Like you think about LeBron. LeBron is an athletic phenom. Like he has the body. He can, he has the body to be a basketball player, right? Kobe didn't. Kobe wasn't the fastest on the court. Kobe couldn't dunk. I mean, he wasn't like he could dunk, but he wasn't like Vince Carter. He wasn't like Zach LaVine, like that can Larry Nance that can like fly type of thing. But yet he dunked type of thing. And I remember one time we're in the training room and we're talking kind of about this type of thing, and Kobe had made a comment about if he was in war and he was in the trenches, right, and the enemy's coming at you, he's like he'd ask, do I want the best soldiers with me, meaning the one that the sharpshooter, the sniper, the one that can hit, or the one that can shoot and aim perfectly. And he was like, no, I don't want those with me in there. What I want is those that have that dog in them, that they're gonna stay and fight to the end, and they're not gonna say, because at the end of the day, if you have the guy that's the best shooter, but they're getting close, and the guy's like, I'm out of here. Is he going to help you? No, right? He's gone. So Kobe was always, I want people that are going to fight to the end with me. I want him to have that dog in them. And I think that's the one thing about Kobe had. He wasn't the best at anything, but he understood that. So he went in the weight room more often. He worked out on the court more often. He understood that he wasn't the best, but he had that heart, that dog in him. Same thing like Michael Jordan. That's the whole thing about Michael Jordan. He got manhandled by the Pistons and understood that, hey, I got to get in there. I want these people. And I think that because of that, and people recognize that and they see that, I think that in LA, Kobe will always be up there.
Yeah, so I'm always gonna be a Kobe fan. I'm sorry I put you in a hard position to answer like all those like
Yeah. Yeah.
Difficult topic, difficult question. I'm sorry about that.
No, yeah, no, it's tough, but like I said, LeBron statistically, if we're looking at statistics, okay, not championships, statistics, numbers, yes, like I said, LeBron by far statistically is one of the best players, okay, but at the end of the day, Kobe is like different.
Yeah,
Michael Jordan was different,
different.
right?
Yeah,
They
yeah,
were different type of athletes, type of thing,
yeah,
and I think that elevates them. I would elevate them more because of that.
yeah,
You know, what I'm talking about you have even if you look in football, you know, Bo Jackson. You know, Bo Jackson was different. You know, he was a beast, right? I mean, that I rather, and then I think that's what Kobe would always refer to is I want players like that have that dog in him, they have that beast in him, that they're gonna fight to the end, type of thing.
yeah. I
So
got you. 100%. Thank you,
that's my
man.
take.
Thank you. I love
All
it.
right.
So I know we've done this before, but still, like for those who are interested in what we're talking about today, no matter it's like ACL return to play, Achilles return to play, movement
Yep.
assessments, or how to help athlete return to play, where can they reach out to you?
Yeah, if you guys have any questions regarding that, you're happy to reach out to me through my Instagram at Marco. I think it's Marco A. Nunez ATC. And just DM me with any questions, any comments. And if you're in the LA area, I live in LA, Orange County, Southern California. If you need somebody to work with, by all means, hit me up.